Great. Hello, everyone. Hello, and welcome. Happy Thursday. Here we are live, and I am so excited to be here with you all today. And today I have an amazing guest and topic, and I cannot wait to delve into this. We are going to talk today about the value of connection in the PKU and inherited metabolic disorder community. So we are so lucky to have an opportunity to talk with Kristen Vanags from Flok. And I'm going to have Kristen share a little bit more about her story and, the purpose of Flok and kind of give you all the background info. But before we do that, I want to just give you a quick overview in terms of some of the things that we're going to cover. So we're going to talk about the power of connection and just how important that is within the PKU community, as well as some of these other inherited metabolic disorders. And I'm pretty sure most of us learned about PKU and other metabolic disorders in school, right? I remember I did, but never really expected to see it in real life, right? And so here we are. I actually have a personal story about PKU, and I'm going to share a little bit more about that as well. But today we're going to really dig into just the importance of developing a sense of community, and that would encompass online groups, in-person events like camps, and also some available daily tools for managing the low-protein diet. And all kinds of good stuff, including, talking about experiences and health data to help drive research. So with that little bit of background, I want to welcome Kristen. Really excited. This is the first time Kristen and I have met. So really excited to chat with you today.
It's great to be here with you, Lesli.
Great. So to kick things off, it would be so helpful if you could share just a little bit about your backstory. So how did you become involved in serving this particular community?
Yeah, so it's way back 17 years ago. My second child was born in 2006, Joe. And when he was 5 days old, he was diagnosed with PKU, phenylketonuria. And so that's how I ended up in the inherited metabolic disorder community. It was, of course, a shocking experience, right? You have this newborn, they look perfectly healthy, and then you get this call that they have a rare metabolic condition, and you are sort of thrown into this world of really having to learn, what does that mean? And of course, the treatment is a lot about a low protein diet. So that's how I got started. At the beginning, back in 2006, we didn't have Facebook groups or Instagram or anything like that. And so I really craved pretty early a connection with somebody else, right? Is there a mom or a dad out there that's going through the same thing that I am? And so that was the first thing I realized in the community, is that there wasn't a lot of connection, but there were a couple of things that were great that are related to Flok's story. So Flok is the organization that I work with now. So I'm happy to share.
Yeah, I want to hear more about your backstory. And I think it would be super helpful. What does Flok stand for and what do they do?
Yeah, so Flok is not a word, but it is a play on the word flock, like a bird, right? So the idea is that the Flok organization has a long history, 30 plus years, and was national PKU news, started by an amazing dietitian that wanted to connect and provide important information to the PKU community. And so way back, it was PKU focused. The wonderful dietitian, Virginia Schuett, she had a 3-time-a-year paper newsletter.
Okay.
And then she also saw that, right, individual clinics and dietitians were having to educate patients on the content, the phenylalanine content in food, right? Because for PKU, you have to maintain a very specific low protein diet, depending on your particular allowance for natural protein. And so it's really important for, parents like me to know what is in food and know it at a more detailed level than what you would see on a label, right? So if you see like something has 2 grams of protein, that really doesn't give you enough information about the content of the phenylalanine component in protein to feed your child or to feed yourself if you're an adult. So the Virginia Shuett, the founder of PKU News, created, in addition to this wonderful newsletter that I was excited to receive when Joe was a baby, and I subscribed, like a lot of people all over the country, is that she created a food list book. And so it had better nutritional information. And it was, a lot of...
Was that the how much fee?
So how much fee was the future of the food list. So you had, right. So for many, many years, people had this printed food list. It was a book or it was a binder that you could print out and that you would order. And then Sarah Chamberlain, who's the executive director was then National PKU News. She came on when the wonderful Virginia Shuett decided to retire. And then Jeb Haber, who's the chair of our organization, Flok, he was also involved. And they really got together and said, you know what can we do to make this book easier for people to use? How can we make it easier to update? And so that we always have sort of fresh nutritional data. And so Sarah developed How Much Fee.
Okay.
So, and it's a website, not an app, but felt like an app or feels like an app. And so that is a tool that has been used by the PKU community and then other inherited metabolic disorder families and adults who also follow a low protein diet found it helpful as well. So we have people that have the other Flok conditions. And so How Much Fee has been an incredible tool to do daily diet tracking. And then you can also...
It's like the Bible from what I...
Yes. Right. It's the digital Bible of PKU because that's what they used to call Virginia Shuett's PKU food list book, the hard copy. So it's fantastic. It has been fantastic. And a lot of people in the community use it today. Flok is the new name for National PKU News.
Okay.
So we are going through a significant transformation, keeping all the great daily support services that we provide, like How Much Fee, and also a whole lot of online support groups that go along with it. We teamed up and combined with a wonderful organization, Cook for Love, that was started by a PKU mom to provide incredible recipes. So that's also under Flok. And so what we've done and why we've changed the name is that we want to serve not just PKU, but other inherited metabolic disorders that follow a low protein diet. So classical homocystinuria, tyrosinemia, organic acidemias, urea cycle disorders, maple syrup urine disease. So those are other conditions that really we want to bring into our community. And there have been people in part of the community, but we really want them to feel like they're part of it, right? That it's sort of all of us. And so we went and decided to change the name to Flok.
Okay. Kind of did a rebrand, right?
Yes.
To encapsulate more people. Okay.
Yes.
Yeah. And I really want to dig into, just some of the stats around these inherited metabolic disorders and kind of talk through that. Before we do, though, I am curious. I'd love to hear from our audience. I know I remember learning about PKU in college and some of the other ones, but mostly I remember PKU, right? That one definitely stands out. I'd love to hear from our audience. Do you guys remember learning about PKU? And have you ever worked with this population in your professional career? Or do you know anyone with PKU for that matter, right? Because I got to tell you, I really didn't know a whole heck of a lot about it until I got the phone call from my sister. That would have been about 10 years ago now, I think, maybe almost 11, telling me that her newborn daughter was diagnosed with PKU, right? And so that opened my eyes really quickly. And in fact, I'm going to show, let's see if I can figure out how to do this. I'll show a quick photo. Let's see if I can do it though. Okay, here we go. I think this is going to maybe work. All right, can you guys see that? So this is my adorable niece and nephew. So this is Briar and Kaylin and their pup. They live in Seattle, and both kiddos were born with PKU. So, and my sister is very open about sharing. So just FYI, I have her full permission and support in, getting the word out. I invited my sister to join us today because she would just have so much insight, but yay for them. They're at Disney. So they are enjoying some family time at Disney right now. But, you can see what's possible, right? Healthy, absolutely, completely normal, healthy, happy, super active, beautiful, beautiful children. So, but again, I really did not have much awareness at all until that fateful day when I got that really panicky phone call, right?
Yes, very scary.
It's so, and I just remember like how they told her. Oh, it just was, it's pretty horrifying actually.
Mm-hmm.
Like she gets a call, they're just like sitting on the couch, the new baby, mom and dad, just, gazing at their new daughter. And it was like, oh my God, get in the car now, get to the hospital like now kind of thing. And they're like, what are you talking about? It was just pure, utter panic. Mm-hmm. So yes. Obviously this, the medical community, I don't think they had a lot of experience either. I think I kind of have a feeling that was probably the first time they had ever delivered that particular diagnosis, just based on what I heard from my sister. So anyway, I would love to hear from our audience today. If you yourself have, known anyone with PKU, if you've worked with this population, just, give us an idea in terms of where you're at. Okay. So you're with Flok now. Mm-hmm. And how long have you been with them? Give us a little bit of background on, and what do you do for Flok?
Sure. So I'm the director of community engagement. So okay. my role is directing our camp programs. So those are in-person and virtual events. And then also just creating a collaborative environment and, staying connected to our partners. There's a lot of partner organizations that represent the other inherited metabolic disorders, and just staying in touch with the needs of the community and that sort of thing, which is what I absolutely love to do. I've been on the staff for about 4 or 5 months. I was actually on the board of directors for about 1.5 years, 2 years before that as well. And then previously I've done over my, adult life, I've worked in business consulting. So in business operations and consulting. So a little different, still problem solving, right? But in a different space, but something that for me has been consistent throughout my career, whether it's part of a nonprofit like Flok or in corporate environment, is that relationship building to me really makes such a big difference in you really helping everybody be successful and happy and have the support that they need. So to me, this is a dream job. I'm working with a fantastic group of people at Flok, both the staff and the board and our advisory members. So yeah, it's great. And then I have also, since 2008, I help run a volunteer PKU organization in the state of Georgia. So we provide local.
What is that? What is that organization called?
It's called Georgia PKU Connect.
Okay.
And we have a family camp, and then we usually have a holiday event. We can provide, scholarships to different PKU programs. And
involved in the big camp. I think they, isn't that in Oregon?
So there is. So that is a camp that has been around. This will be the 21st year.
Yeah.
So it had been previously run by a wonderful organization, PKU Northwest, and Flok. It collaborated with them a few years ago during COVID to do a virtual event, and then they've wanted to pass that camp along to the Flok organization. There's crossover. I think something you see a lot in the rare disease community is that we wear a lot of the parents or adults with the condition. We all wear a lot of multiple hats. And so Flok now for the last few years has been running this Oregon camp, and it's a 3-day camp in the end of May. It's huge. Last year we had 250 people come to Antelope, Oregon, and it's just very magical because you have people that have gone for the 20 years, right? Since they were little, and now they're grown up, and they can talk about what a difference it's made to really connect with others with the condition that they have, because they're rare. PKU is very rare, 1 in 15,000 births. Okay. And then our other Flok conditions are even more rare than that. And so being able to come together really can make a difference. It really can make or break, whether a child or a teenager or an adult can maintain the diet, because it's so strict, right? I mean, you have to watch everything that you eat every day.
These kiddos, they can't just go to a birthday party and do what all the other kids are doing. I've witnessed this firsthand many, many times. And like I said, my sister and her husband, Kara and Jeff, they make it look so easy. So easy. I know it can't be. I've been watching them weigh and measure and log every morsel of food for 2 children since they were born.
Yeah.
Right?
Yes, it is definitely an exhausting thing, but I think I just, as a mom, and my husband feels, it's like you just sort of jump in there and do it, and you make it part of your day, because you want to protect them, protect their brain and make sure that they can live, a full, happy life. And so yes, but not easy. And I always say, I think I was talking to some teachers. When your child is in school, you can have an annual meeting with the school to make sure that they can maintain their diet during the school day. It's really important. And I had that phone call for the year a few days ago, and I was telling a teacher that had no idea my son had PKU and what that was. I said, he's just so resilient. I'm so proud of him, because it takes a whole lot, right? I mean, most people, if I think I can't follow a diet for more than a couple of weeks, a month, or whatever, it's hard. And to think that individuals with PKU or the other conditions like homocystinuria follow their diet day in and day out.
Mm-hmm. Can you tell us more about that diet, especially since we've got, healthcare practitioners here? Like, what does it look like in real life?
Right. So,
it's like, I know what I see. I see a lot of weighing and measuring, and I also see formula.
Yes.
Right?
Even the formula.
They're getting older. My niece and nephew, I think that's still a staple in their diet. So just any information on what does that actually look like?
Right. So for most people with PKU, the formula is sort of the center of the treatment. Okay. You have to drink, and it's regulated by the FDA as a medical food, but it usually comes in a liquid form, powder mixed with water.
Okay.
And every single day you have to get up and you have to make a jug of formula. Some people will make it in different servings, but in general, right, think about a Nalgene bottle, right, a 28-ounce big jug. That's how we mix ours every day, and you have to mix it. And then your child or your adult teen, they have to have a serving of it, and you want to make sure you have at least 3 servings a day. You spread it out. So that is the critical piece, because it's providing most of the nutrition they need without that offending amino acid. And for PKU, that's phenylalanine.
Okay.
Right.
And for people that don't know, just in case, and you correct me if I'm off on this at all, Kristen, but it's the inability to metabolize phenylalanine, which is an essential amino acid, right? And the thing is that from my understanding, you do need some.
Yes.
You need a teeny weeny bit, right? Because it's essential.
Right.
And, kind of acts as a building block to, create other proteins in the body. So you do need some. It's not like can't have any. You got to have a little tiny bit. And how do they determine what the limit is? Or
right.
And is every person different? I think the answer is yes, but tell us a little bit about that.
Yes, everybody is different. So it's figuring out what each individual's allowance for phenylalanine is or need in their body is really a trial and error, right? Okay. When they're little. So you're giving them a certain amount of the formula, and then you will either do some breast milk or some regular formula, and you're paying attention to how much phenylalanine or natural protein is coming from that other source of nutrition, right? Mm-hmm. And then you test the blood. So we can do a newborn screening test. Most people can do that at home. You prick their heel when they're little finger.
Yes. And then you that's how they diagnose it, right?
Yes. So you can continue to do that. Okay. Yeah. So parents really turn into, nurses in a way, right? They have to learn how to do this on their tiny little baby. And so you test the blood frequently when they're young, at least maybe once a week. And then based on the phenylalanine in the blood, you go up and down on the amount of phenylalanine from the natural protein source. Okay. To figure out what their tolerance is. And you can imagine children grow, right? Yes. And their metabolism is changing. And so that's why the blood testing is really important, especially, we do it for life, but more often when they're young and they're going through growth spurts, because you really are adjusting that tolerance for phenylalanine throughout their childhood and then really beyond. But you do get a sense of how much, right? Okay. So when my son was young, he could have about 7 grams of natural protein, which is
7 grams,
which is generally on average 350 milligrams of phenylalanine.
Okay.
So there's a conversion there, but there's not the same amount of phenylalanine to protein ratio in every food. They're different.
Mm-hmm.
So
what are some like low phe foods? Like, if you can give us some examples.
Right. So
are there free foods?
If it's pure sugar.
Oh, God.
That,
great.
But it's free.
Right? Just what you want, right?
You can have all the oil you want or sugar, that, yeah.
Okay.
So,
like popsicles,
right? As long as they're not sugar-free, right? Because
right.
aspartame is not allowed in the PKU diet because it's made more than 50%. I don't know the exact percentage of phenylalanine. So, but yeah, those are more free foods. So carrots, other than that, nothing's really free. Now, some things, depending on an allowance that somebody has, maybe you don't count them, like watermelon, but those does have protein. I remember parents would say to me, they would look at fellow parents and they say, why are you measuring the watermelon?
Yeah.
That doesn't have any protein, right? They'll say, and I say, oh no, there actually is. So,
well, that's how detailed you have to get, right? When you're counting these milligrams of phenylalanine, like I would never think of watermelon as a protein source, but there is a little tiny bit in there, so you have to count it. I wanted to ask you about, so we were talking about the formula, and just the fact that it is a mainstay in the PKU diet, right? How long does that last? When I went to school, I'll just put it out here. I know this is going to make me sound really old, but it was like till they're 3 kind of thing, if I remember correctly. Like it wasn't for life. It was like, okay, well, the brain's pretty much, done its thing by around 3-ish, I think, if I remember correctly. But I know now, of course,
right,
better. It's still developing at like by 25, right?
Yeah. So it's changed, over the years since the 1950s, when they really started to understand what was happening with PKU, and they started diagnosing in the 1960s. In those early years, they thought the brain development ended, at different times during childhood, right? we know now that you have to maintain drinking your formula through your whole life. So it is critical. I mean, I don't know if during when your brain is developing and you're growing, yes, it is probably more critical, but if you have high phenylalanine levels at any point in your life, you are doing damage to your brain.
Okay.
And the formula is also critically important because for PKU, tyrosine is something, in our bodies, we don't have PKU, phenylalanine turns to tyrosine, precursor to dopamine.
Okay.
And all these other good things. So people that have PKU can't create enough tyrosine.
Oh, okay.
So the formula also has that added to it, which is critical, right? To like our mental health and a lot of other things that are happening in our body. So you have to drink it for life. So it just
so it's got to be difficult. I wanted to put a comment here. Roxana knew a friend of my son's classmate in high school. Remember her coming to a party, and she came with her special formulas. Wow. Yeah. She ate the foods that she was given, I think, from the Family Nutrition Center. Yeah. Mm-hmm. And she knew what she could eat. Yeah. I remember taking a trip with my sister and Karen, and they just had Kaylin at that point. So just one kid. And, they just make it look so easy, right? Mm-hmm. Like, I know it is not easy, but they had their own, they brought this little cooking griddle, right? So that they could make her special pancakes, to bring to breakfast, right? Because obviously, same thing with like birthday parties, they would make Kaylin's special cake that she got to eat at the birthday party, right?
Yes. You always have to plan ahead.
Yes.
With these diets, right? You always have to sort of be thinking about what am I going to eat, which has got to be exhausting, right?
Oh, yeah.
For parents or an adult.
These kids like the formula. I don't know what it tastes like, but
it doesn't taste great. I will say that for us, right? Because we're not used to it.
Okay. So maybe for them,
it depends, I think, right? Because maybe they've been on the same one for a long, long time. And so maybe their taste buds have acclimated. They're just used to it. They wouldn't taste it the same way as we, but generally they don't taste great, right? Because a lot of it's individual amino acids and it's hard to switch from one formula to another.
Oh, okay.
Which is, something we saw when there was that very significant formula crisis a couple of years ago.
I do remember long ago.
So the PKU community and the greater metabolic community was impacted by that very significantly.
Okay.
It was scary because there were a lot of people running out of the formula, and then they had to switch to other products, but then the other products, right? It's a rare disease. So it's not that they have so much of it, right? They had to ramp up production. So that was a very significant thing. And Flok was very involved in the advocacy work and coordination with, between understanding what was happening from the FDA and the manufacturers and the community. So it's the formula.
So our friend has to leave. Okay. Yes, absolutely. Thank you for joining us. I so appreciate your comments, and great topic, and really appreciate Kristen coming on with us. So, Kristen, I'd love to hear about, how your son is doing. So I think you said he's 17.
He's 17.
So he's in the throes of, let's just say, the pizza eating years, right?
Mm-hmm. Yes.
I'm curious about, how that's going.
Yeah. So, it's not easy, but he's doing really, really well. I'm super proud of him. He takes, in addition to his formula, which he drinks 28 ounces of it a day, which is a significant amount. Okay. He takes a medication for PKU. So there are 2 approved drugs that have come to the market in the last, 10, 12 years, which don't work for everyone. One of them works pretty well for him. So his allowance is a bit higher, but he still has to pay attention to everything. He's still a vegetarian, even moderate protein foods. He has to be very, very careful. Like cheese, pizza is very high protein, right? So, but he does, he's doing really well. I think something that I really tried to do with him is talk to him about the science, right? About the nutrition, like what is happening in his body when he's drinking the formula. And that has been thanks to his amazing dietitians at his clinic, because they answered all of my questions over the years. And then I could help, educate him about it. So that helps him, I think, stick to it, even though it's really hard, because he wants to make sure that he's protecting his brain. He's getting ready to go to college. I mean, he's a junior.
He's at that age, right?
Taking SAT and thinking about college. And so I'm grateful that he has done well, but yeah, it's not easy. I mean, I think back, when he was a toddler, I used to carry a little Ziploc bag everywhere I went. And if he dropped food on the floor, I picked it up because I had to know like what he ate and what he didn't eat. Right. So if I think back over the years and now, he does a great job, makes his own formula every morning, unless he's not feeling well or tired, I'll do it for him for sure. But, he's going to be 18 in, 8 months or so. And so have to coordinate all of those medical, doctor's appointments and dietitian appointments. And
it's a lot.
It's a lot. And I have to trust that he's,
I was going to say, it's up to him.
It's up. Yeah.
It really is up to him. So what happens if you've got a rebellious kid? Yeah. Just curious about that. Because, what I see so far is Kaylin, just awesome. I haven't witnessed any of that yet, but I do know sometimes it's really hard. And I have witnessed tears,
Oh yeah. There's a lot of like, I wish I didn't have this, I can remember, or like, I'm going to throw this formula in the trash can. Like it tastes gross or whatever it is. And I know in our community, that is a common thing, and it's understandable, right? It's hard. Like as scary it is as parents, we understand, gosh, there are days where this is not fun and they do not want to do it. Yeah. The camps, whether they're in person or have virtual camp, or any time that we can get people together, makes such a difference, because it can really change. There were 2 little girls, they were 6 years old, came to camp one year. One was having a very difficult time drinking her formula. The other one was doing it like clockwork, no problem. Okay. They met one another, and the one noticed the other one was drinking it. And then wouldn't you know, after that, she was drinking it, no problem. Right? Like there's little, experiences that when you bring the community together can make such a big difference in their life, really. So I'm super excited to be part of that program at Flok in directing our camps, because we're excited. We're continuing to do the one in Oregon, which is incredible. And then we're starting a new camp in New Hampshire this year. It's going to be in September.
Oh, nice.
So yes, we are very excited. We're teaming up with a YMCA camp organization, and
fabulous.
Going to create an experience there. So
I just know that, I personally have not been to the camps, but I know that my sister, the family goes. It's a really, really important part of their lives every single summer. So really so critical. So there's a couple things I want to make sure we touch on. I want to touch on, are there any other resources and support mechanisms that you want to talk about that maybe have helped you along the way, or that are helpful for parents or, anyone dealing with PKU?
Yeah, absolutely. So Flok has a couple of online support groups on Facebook. One is around the How Much Fee, which you mentioned earlier, that still exists and people are using it. And we're eventually going to transform them to a brand new app called the Flok app that is going to have all the amazing dietary information and tracking. And then in addition to that, you'll be able to put in your mood and your symptoms and medications, connect to a Fitbit or Apple Watch so that you can pull in biometric data. And that is the idea is there we're going to, as a community, bring together more information so we can improve and understand what the patient care landscape looks like and accelerate research. So that's great. So there's a how much fee online support group. There's also a Flok Facebook group. That is fantastic. There are other online groups like PKU parents. There's a number of different ones. And then our partnering organizations like HCU Network America, they have resources as well and Facebook groups that they run that are fantastic. So I think the online groups are very helpful. The 2 in-person camps that we have, there are other regional organizations that have camps around the country. So I think no matter what camp is closest to you, sort of getting there is really helpful. We, send newsletters with information. It's we have a scholarship program for individuals going off to higher education. And we're going to we're working on a fellowship program to bring back, we have, I think, given out 200 or so scholarships over a couple of decades. So I think just any way people feel that they can get involved, whether it's online or in person.
Okay.
It's great. Yes.
And why are you so excited to be a part of the Flok organization? Tell us a little bit more about that.
Yeah, I'm excited because I love how their programs really meet people where they are, right?
Okay.
So they help people with the management of the diet every day. They also provide the forums for people to ask questions about anything. It doesn't have to be related to diet, just managing the conditions, right? Or getting together, right? Like say, hey, we're having this. There's a bunch of people going to Disney World. Do you want to come too? So I love the sort of this new vision and what they're trying to do to bring together and make it inclusive of all of the inherited disorders that are related to protein metabolism.
Okay.
And that cross collaboration with other organizations and community members to me I just love being a part of that because I think we're a little bit different, the conditions, but we have so much in common. Mm-hmm. And that really, way back when I first got involved with PKU advocacy work, I had the fortune to go every year to a conference that was about all of these conditions in the Southeast with alongside professionals. Okay. And they brought in parents and families and adults for these other conditions to talk and brainstorm and see how we collectively can help one another. And I see that in what Flok is doing. And so it's exciting to me. I can't wait to see what the next year or two brings.
I am curious about the research because I do know at like the big camp every summer, because my sister, she'll be texting me, oh my gosh, I'm learning about such and such, right? Like new research coming down the pike. Who funds that? Like, how does that work?
Right. So there are different organizations that fund research and then pharmaceutical companies, because there's only so much a patient community can do, right? They can do a little bit of seed money for researchers. And we have a science night at our camps that we have one of the medical professions come and give an overview of what's happening, which is fantastic. But what Flok is really excited about doing is bringing patient data together. So in addition to diet, that biometric data, mood data, symptoms, and that way we can look across the PKU and the other metabolic disorder communities and see what is really happening out there, right? Because right now, all of that patient data is really siloed in the clinics. Okay. And so we don't have really a true picture. So I think our communities coming together in what will be the Flok app, right? Sort of version 2. Of how much fee. It's more than version 2. It's a whole new tool, but I think that's really exciting because it's going to accelerate research. We're going to be able to see things that we've never been able to see before, right? How does activity? if you're running a marathon, how does that affect your phenylalanine level in your blood? Does that mean that you need to eat more calories? Do you need a different kind of formula? Like, we'll start to be able to see that if we all come together.
Yeah. That's amazing.
Yeah.
So what is your dream or your hope for the future?
Well, I would love for every member of the inherited disorder protein metabolism community to have a connection, like whatever that is, right? Whether it's an online, in person, maybe they're just using the Flok app, whatever it is, I would love to see our whole community connected. We have a lot of adults with PKU that are, not connected to care any longer. A lot of that has to do with access to formula and low protein medical foods, which is devastating and something we're involved with advocacy for many, many years. Bringing them back.
They don't have, so there's adults that no longer have access.
Right. I mean, this is a significant issue in this community, is that because they're regulated a certain way, they're not covered, say, on your pharmacy plan, unless you live in a state or you're part of a program that has required that. So we have a very disjointed coverage system for those products in the United States. And it is
very expensive.
They're very expensive. Okay. So, I mean, if I were to pay out of pocket for my son's formula, it would probably be around $1,700 a month.
Whoa.
Okay. So, it's not affordable
it's not doable.
If you don't have it part of your insurance coverage, or if it's not part of a state program, public health program. So that is a significant issue. So dream, everybody has some type of connection, right? Whatever it is that works for them, that everybody has access to the treatment that they need. That is, to me, critical, right? Because you have to have that. Otherwise, you can go to a clinic, return to care, but if they can't get you the treatment, there's only so much, your dietitian or your geneticist can do for you. So that's definitely a dream. Like, my wish is, access to treatment, and then being part of the community in any way that is helpful to you. And just accelerate research. We need better treatments, right? We so grateful for the dietary treatment, incredibly grateful, but we need some things that are easier for people to manage on a daily basis. So
absolutely. So Kristen, what's a good next step for folks that are listening?
I would absolutely love if everyone would check out flok.org.
Okay.
flok.org.
Okay.
We have been building, that's a brand new website that we have been building out, right? Because we had a PKU news website. So go to flok.org, and we have all kinds of blogs. There's one on nutrition science, how we want to use patient-led data with machine learning and AI to accelerate research. There's all information about camp. So certainly, if anybody is willing to make a donation to help us, that is fantastic, because we can't have the programs and create the awesome apps without the support. But I think just if you're dietetic community, just having, just learning about the conditions and is helpful, right? Because you never know if you're going to end up in meeting someone or having somebody walk into your clinic that has this type of condition. So we appreciate any kind of support.
Okay. Yeah. So I would ask, if you guys are willing, check out flok.org. You can see the website on the screen, and that's FLOK, right? I spelled it correctly.
That's right.
.org. Check them out if you can. Donations are welcome, and they really, really help move this forward, the entire process forward. So, okay. Any kind of final words of wisdom as we start to wrap up, Kristen?
I would just say, thank you so much for having me. It's really a great opportunity for a rare disease community to have, a forum where we can talk to so many people and share sort of the experience of the patients and ask for the support. So just, thank you. Thank you for everybody to, for listening.
Yeah. We'll do it again. How's that sound? We'll do it again.
Sounds great. Sounds great.
This like every year-ish, like around this time of year, but it'd be it'd be interesting is to maybe dig into one of the other, disorders.
Yes,
Right?
that would be great. We just started, we're sending newsletters and doing blog posts about each of them on our website. So there's a brand new one about classical homocystinuria that
Okay.
was posted this morning.
Oh,
So yes, so
I
we are
didn't know
going,
about that.
yes, so we're going to have a feature for every single one because we really want to make sure that all the conditions and the community members feel that they're part of the organization.
Oh, that's great. Okay. Well, we will definitely be in touch. We'll have you back on so we can chat in more depth, perhaps, about one of these other disorders. And I think that would be really interesting and helpful as well. So, all right. Well, I want to thank you again, Kristen. Thanks to our audience. I appreciate your support. And listening in today and your participation with commenting. Really appreciate that. And I will look forward to seeing you same time, same place next week. All right. Take care, everyone. Bye for now.